Our next presentation will be by Dr. Mona Alsumaie. Dr. Mona Alsumaie, she is a consultant and the head of Community Nutrition Promotion Department at the Food and Nutrition Administration, Ministry of Health. Actually, she is the very first lactation consultant in Kuwait. She had the IBLC on 2003, yes. And she will be talking to us about the clinician role at breastfeeding. Thank you, Dr. Mona.
Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh. I want to thank the organizing committee for giving me this opportunity to talk about breastfeeding in pediatrics conference. Actually, they have asked me to talk about the clinician's role and breastfeeding. So if we talk about breastfeeding, that it is one of the most effective ways to ensure child health and survival. And if every child was breastfed within an hour of birth and given only breast milk for the first 6 months of life, and then continue breastfeeding up to the age of 2 years, then we are saving 800,000 child lives, according to the World Health Organization. And if we think about the level of breastfeeding, it is declining everywhere. Why this is happening? A lot of factors influencing this change in the breastfeeding rates. If we talk about these factors, then we have to, as clinicians sitting here, we have to concentrate on, on this factor, which is about the health professionals. Health professionals, usually they are taught about formula, not about breastfeeding. And then also the practices which are done nowadays, all modernized. Yeah, but it is not going. Okay. So it is not modernized. Now all medicalized birth practices, this is all took us away from practicing the breastfeeding with the mothers. And I will not go through all the factors, but I will talk about the influence, the level of influence on the mothers and the breastfeeding mothers. If we consider it in a public health view, that the individual, which is the mother, the breastfeeding mother, is having on her circuit effect. The effect is by her knowledge, how much knowledge she is having, her attitudes, her beliefs. And then she has another circuit which is surround her, her family, her peers, the social network, and then the bigger circuit, which is the community, the social networks, the norms, the traditions, and then the institutions, our hospitals, our clinics. How are we practicing? Do we have rules? Do we have regulations? And then the overall country. Do we have law to protect the mothers? Do we have practices and policies that will really help the mothers to practice the breastfeeding? And as clinicians, we have a role among each part in these circuits. Now, globally, there are policies which are regulating and supporting breastfeeding. Since a long time, this has been done. And if you notice the dates, starting with the International Code of Marketing of Breast Milk Substitute, 1981, and then the Innocenti Declaration on protecting, promoting, supporting breastfeeding in 1990, which is about 10 years gap. And then we have the Baby Friendly Hospital Initiative Program by WHO UNICEF in 1991. And then the Infant and Young Child Feeding Global Strategy in 2002. And lastly, the WHO Maternal, Infant, and Young Child Nutrition Plan in 2014. Each one around 10 years gap, which is the period expected to have influence in a public health view. Now, going back to the role of clinicians in breastfeeding, we should be promoting breastfeeding, we should be supporting breastfeeding and protecting breastfeeding. So talking about how can we promote breastfeeding, we should have the information, the knowledge, which is up to date, accurate, so as to have this information and to be in a powerful situation. We need to know the importance of breastfeeding. We know, everybody knows that breastfeeding is having benefits. It is beneficial. But we now are talking about the importance of breastfeeding. So breastfeeding is recognized as a unique process. It is providing ideal nutrition for the infant. It is contributing to the growth and development, also reducing the incidence of severity of infections. So it is lowering the infant mortality and morbidity. Also for the mothers, it is reducing the risk of breast and ovarian cancer. And for the whole society, there are a lot of economic benefits for the whole community. We should also think or know about risk of not breastfeeding. With not breastfeeding, there will be less immunity for the infant, more disease, more diarrhea, more respiratory tract infection, more otitis media, more allergies, and lower IQs, with higher infant mortality, and for the mothers, more breast and ovarian cancers. Also, don't forget that infant formula is contaminated. Contaminated with what? Many things. Along the past years, a lot of incidents, cases have been shown that the infant formula is contaminated or can be contaminated. Contaminated with materials. For example, broken glass, fragments of metals, metals like aluminum, manganese, cadmium, lead, mercury, arsenic, chemicals like melamine, nitrates, neurotoxins, bisphenol, phytoestrogens, pesticides, even insecticides, solvents, and even microbes, very rare microbes and very nasty microbes like E. sakazaki, like salmonella, also E. coli can be found in such formula in the cans, and even in a period came that melamine contamination was found in 8 brands of powder milk in Bangladesh. And there was a tragedy which was called melamine tragedy in China in 2008, where at least 14 children have died, and over 50,000 became sick, and children in thousands developed renal failure and renal stones because of the contamination of the powdered milk formula. WHO and FAO in 2004 have stated that infant formula is not a sterile product, and there may be microbes in the powder milk, and there is no technology available at present to produce sterile powder milk. So what was the action from WHO FAO? They have published safe preparation, storage, and handling of powdered infant formula guidelines in 2007, and it is present online on the WHO website. So what are the rates of breastfeeding and exclusive breastfeeding in Kuwait? What do you expect? Is it considered low, moderate, high? Low, moderate, not high. You are right. According to Kuwait Nutrition Surveillance System, results between the period between 2006 until 2014, And I will just talk about the latest, which is the 2014. And you can see the ever breastfed rate, which is if a baby have been fed even once, been included in this number, and it is 84.8%, the latest results. And you can see that the rate usually ranging between in the 80s, but now we consider that there is a little increment in the number of the ever breastfed rate. If we talk about the exclusive breastfed rate, there is increment, as you see, along the years. And in 2014, it has reached 19.5%. There are a lot of, there are programs that are promoting breastfeeding in Kuwait. And the first program, or the main program in Kuwait, which is led by the Kuwait Breastfeeding Promotion and Baby-Friendly Hospital Initiative Committee, and it has been running since 1998 until now. And then the second one, which is the lactation consultant, and it is a certification that is international certification, and we have the exam in Kuwait, which is yearly done on a yearly basis with a program for preparation for the exam. And then in the community, we have the Birth Kuwait nonprofit community mother support group, which was established in 2011, and still they are working and doing a great job. Also, we have the IFAN Arab World, which is the International Baby Food Action Network. It is a network globally present in all the continents of the world. And lastly, we had it as Arab IFAN, and I have been elected as to be the president of this Arab IFAN. Of course, you are invited to be part of these programs and to help in increasing the rates of breastfeeding in Kuwait. Also, we can ask you to be part of the Baby-Friendly Hospital Initiative and to help your hospitals to get this award. For example, we have the Adan Hospital, which by the staff, which were marvelous, working marvelously, and they got the award in 2014 to be the first baby-friendly hospital in Kuwait. The second thing in your role as clinicians about breastfeeding is to support the breastfeeding. To support breastfeeding, you have to think that it is unethical to promote breastfeeding without implementing supporting practices. Don't tell the mother you have to breastfeed and you are not helping her and not able to have her in an environment which is helping to start and to establish the breastfeeding. The environment should be well organized, well done for the mother from during pregnancy, in the antenatal period, also at delivery, and then in the postnatal period. All this should be well organized to help the mother, to support her. At the delivery room, we need to have skin-to-skin contact to be started. From the first moment the baby is born, should be kept with his mother in skin-to-skin contact to get the marvelous benefits, a lot of benefits for the baby, a lot of the benefits for the mother, just from this 1 hour skin-to-skin contact, which is mandatory to be a baby-friendly hospital. You have to practice this practice, and it is not connected or related to breastfeeding. It is just skin-to-skin contact with all the benefits for the baby and the mother. Beware and avoid routine supplements. Don't give any breastfeeding mother a formula. Even 1 bottle of formula can do a lot of harm. So please think before giving any baby, breastfed baby, formula unless it is really indicated. Why? It can interfere with the breastfeeding and even can contribute to health problems for the mother and her baby. It can make the baby less interested in breastfeeding and cause nipple confusion. Even it may contribute to the newborn jaundice. Formula supplements can sensitize some babies to allergy, increase the chance of engorgement for the mother, and decrease the milk supply, and strongly correlate with shorter duration of breastfeeding. You need to tell the mother, and you yourself know about positioning the baby during breastfeeding. A lot of positions can be taught to the mother that will help her to have the proper and the good initiation and the good latch for her baby. And this is a position which I thought of sharing it with you as pediatricians, which is the biological nurturing position. It has recently been introduced by the breastfeeding literature in 2010. Just as in the picture, the mother is lying on her back with her baby just extended on her abdomen. This will promote the release of the primitive neonatal reflexes. As pediatricians, neonatologists, you know that there are primitive neonatal reflexes which are normally developing in the newborn and should respond to certain stimuli with reflexes which eventually become inhibited as the child matures. So just to remind you of the reflexes, these reflexes...
Dr. Mona, sorry, 4 minutes.
Good,
just because you mentioned Adan Hospital, wasta.
Thank you. So the primitive neonatal reflexes, just a reminder for you, these are the reflexes which will be started or initiated intrauterine, in utero. And then the baby will be born with these reflexes. We as pediatricians, and me as one of the pediatricians, we didn't know why this is happening, why these reflexes. We were just examining the baby, and it is there on birth, and then it will continue for 2 to 3 months, and it will disappear. Now they are connecting it with the position of the biological nurturing and the baby crawl. They noticed that the baby newborn can crawl if put in this position and go to reach for the natural source of feeding, which is for the breast of the mother. There are good videos you can watch on the YouTube for the crawl of the baby to the breastfeeding. Also, you need to know about the signs of a good latch and the signs of bad latch. The bad latch is usually, with the first sign, will be pain. Any mother breastfeeding complaining of pain during breastfeeding, then this is #1 bad latch and should be referred or should be assessed for the breastfeeding. And if we cannot help her, you should refer her to a lactation expert or any who can help her. So the take-home message to support breastfeeding: the importance of the skin-to-skin contact, early breastfeeding initiation, types of breastfeeding positions, correct latch, and if the breastfeeding hurts, then think of the positioning and the latch. Avoid supplementation. Check the weight gain using the WHO growth standards. The last thing about your role is protecting breastfeeding. How can we protect breastfeeding? Well, we should know the tactics and understand the marketing tactics have been done by the companies in order to reach the mothers and the babies. A lot of tactics to reach the mothers and the babies. They are doing it everywhere, in the mass media, in the retail outlets at shops, and also at our place, in the hospitals, in the clinics. They are trying to reach the mothers and the babies. Also through us as doctors and nurses, they will reach the mothers. Also through the professional associations. Through professional associations, by, for example, sponsoring conferences, by giving even cash money, supporting all this, they will reach the doctors and nurses, and then they will reach the mothers and babies. We have the Kuwaiti Code, which, alhamdulillah, have been launched in August 2014, but still we have some challenges in the implementation of the code, which is still in process. Also, our Ministry of Health is accepting the ready-to-feed formula free supply, and our government is subsidizing the infant formula for the Kuwaitis. The other thing which
2 minutes, Dr. Mona.
Inshallah, I want to share with you is that we should all be part of the monitoring process. Monitoring is everyone's responsibility. Monitoring can be done anytime, can be done anywhere. And I want to talk lastly about the conflict of interest. Professionals have conflict of interest when their interest or commitment compromise their independent judgment or their loyalty to whom they have ethical and legal duty to serve. There is no such thing as a free lunch. Don't expect that they will give you something and they will not take something back from you. It is better to starve free than to be a fat slave. Why like this? Now, I will give you a case which is really has happened. The 25th International Pediatric Association Congress. This Congress in 2007 has been attended by over 6,000 pediatricians, and then all the 24 previous Congresses were sponsored by the milk companies. Then the IFPAN and WABA, IFPAN Asia and WABA, have sent a letter, a protest letter and appeal to the IPA about this. So what has happened? The IPA offered breastfeeding symposium at the Congress. IPA offered a booth to disseminate information on breastfeeding, and the IPA offered to jointly organize workshops and courses for the pediatricians at the national and regional level. And in 2009, the IPA president has said companies that produce breast milk substitutes for infants are strictly banned from sponsoring the IPA Congress, since their activities conflict with our goals on exclusive breastfeeding for babies. There are a lot of areas of conflict that can be tackled. And lastly, knowing is not enough, we must apply. Willing is not enough, we must do. And thank you very much.
Thank you very much, Dr. Mona, for the very clear, informative presentation. There is one question only, please. Time for one question, if you will. Thank you, Dr. Mona.